A client, a
Okay.
client receives chemotherapy has the following assessment finding: temperature 101.8 degree Fahrenheit, WBC 1000 mm3, NC, ANC 400, report sore throat. Which action the nurse take? Select all that apply. Obtain blood culture. Place fresh flowers in the room, administer prescribed antibiotics, encourage raw fruits and vegetables, initiate neutropenic precautions. So, chemotherapy and then assessment finding. Temperature is 101. Okay. See, okay. Mm, And ANC, a report to sore throat. So, which action should the nurse take?
What is the condition? You first analyze the scenario. Scenario means here the scenario is a client which is receiving chemotherapy. Okay.
Therapy.
Yeah.
And
So has the following assessment findings. That these are the assessment findings: that temperature 101.8 degree Fahrenheit, WBC 1000, ANC anti-nuclear compound 400. Yeah. Then reports sore throats. Okay, that means the client is having some infection. Understood? Temperature is there, sore throat is there, WBC is also low. Okay,
so,
leukopenia is there. We know when there is a leukopenia, there is a the client is susceptible to infection. Okay, and after getting infection, the WBC level will get increases. But
yes.
here, yeah, here the we know the normal value 4,000 to 11,000 is the normal WBC. 4,000 according to the institutional value. The mostly 4,000 to 11,000 considered bar mm of Q considers a normal WBC. But here the WBC is low. That means the client is having what? Leuko
Leukopenia.
leukopenia is there. So likewise, leukopenia and neutropenia both have similar management only, because they both are getting the risk for infection. Okay, so
Mm.
what our focus is to, that means the question is asking about which action should the nurse take.
Take.
Yeah, that and SATA question. See, that means we need to select more than one option as the correct answer. Okay, so what is the
Yeah.
correct answer here? You can just check it. Obtain
Uh,
blood culture. Is it neither?
yes. Yes.
Neither? Why?
Because temperature is 101, so still we don't know what is a sore, and they are having sore throat also. Chemotherapy, they are receiving chemotherapy, so
Okay,
we don't
so
know whether which
okay,
infection
so
we need
you
to
are
take.
doing blood culture also, and place fresh flowers in the room.
It should not, because they will get more frequent this one infection, so we are not putting that one.
Okay.
Administer prescribed antibiotic. Prescribed antibiotic, yes.
Yeah.
Okay, prescribed, yes.
Okay.
Encourage raw fruits and vegetables, no.
Why?
We are not allowing to take because of uh, um, more getting more infected, and then what is
That means
uh,
as in neutropenic precautions, we fresh fruits, vegetables, fresh flowers are not at all
uh,
recommending for the client. Okay. Initiate neutropenic precautions. Is
yes,
it?
yes,
Yes.
yes.
So your answers are, what are the answers?
ACE.
A, A, C, E.
E.
Is it? So we can check it. Yes. Because already the client is showing the symptoms of infection, fever, sore throat, WBC also, 1000 only, and prescribed antibiotic. Always prescribed antibiotics means already the doctor has ordered for the antibiotics, so we can give it. Initiate neutropenic precaution. What are the neutropenic precautions? If the see ANC is less than what the ANC is 400 only. That means it is low. The client is already what neutropenic. So here the client need to put on what neutropenic precautions. That means we should avoid fresh flowers and we should avoid raw fruits and vegetables. Okay, but in the option it has written place fresh flowers in the room. That is to be eliminated. Okay, and
Mm.
encourage raw fruits and vegetables. That is also eliminated. Okay, it is very important question. Okay, it can this
Yeah.
question you will get in any kind. Okay, so you have to be very thorough with that. And one more question here: the nurse receives the reports. You can read it and find out. So it will be better.
The nurse receives the report on 4 oncology client. Which client should be assessed first? Okay.
Yeah, prioritization
Breast,
of that question. Yeah.
yeah. Breast cancer client requesting pain medication.
Hmm.
Leukemia client with ANC 200 MEQ and temperature is 1 or 2.
Hmm.
Okay. Colon cancer client with nausea. Lung cancer client awaiting discharge. So, priority
Here, which
oncology.
strategy you can apply?
ABC.
ABC is needed, otherwise it is a situation based.
Stable
So,
versus stable.
so
Yeah, stable
stable
versus.
versus unstable. Okay,
Yeah.
okay. You just
So,
find out which is the unstable patient, which is the stable patient, because unstable
yeah.
patient need, so if you are getting such kind of question, that means which patient should assess first or which client need immediate attention, like means you have to apply the strategy stable versus unstable. So you can choose the patient. Unstable patient need assessment first, stable patient we can assess later.
Okay.
Okay, so we have got 4 options, so we can what read and to find out which patient is unstable and which patient is stable. Okay, we can find out.
Breast cancer client requesting pain medication. So this can be. Uh, leukemia client with ANC 200, so low, and temperature also is there. I think will stay. Next, we'll see now. Colon cancer client with nausea. Colon cancer with nausea, yeah, it will be there. Lung cancer client awaiting discharge. So I think it's also stable. B, ma'am.
You are choosing B,
Yeah.
and why you have eliminated option A?
Breast cancer client requesting pain medication. Pain medication. I think if you are comparing to this two, this is the second one is the more priority, I guess.
So yeah,
This
that means
breast cancer
in breast cancer there is uncontrolled multiplication
pain.
proliferation of the cells. That means the gland is having severe pain. So the pain medication, but here nothing has mentioned about the pain score. Okay, so
Yeah,
only it mentioned breast cancer. It's a chronic pain. Chronic pain, acute versus chronic. The acute client need what immediate
chronic,
attention as comparing with the chronic. So we can
chronic.
eliminate. You have eliminated option A. Then colon cancer with nausea.
Cancer patients anyway, they will have a nausea sensation. That is expected, ma'am.
Expected only. Yeah. So you are eliminating option C. And last one, lung cancer client awaiting discharge.
Yeah, they are stable, I guess. So they are getting discharged, no? So
Okay.
they can be
Yeah. In why you have selected leukemia with the ANC 200, temperature 102?
leukemia. ANC also low, and then temperature is there. They are more prone to get infection, no?
More prone to get infection.
Infection. Yeah.
So you have choose with the option B. Can I check the answer?
Yeah.
Yes, that is the because here already the client's NC count is what
The-
less only. The neutrophil count is minimum the client need 500. Okay, and if the neutrophil count is less than 500, the client is on neutropenic stage. In addition, the client is showing that fever is there, temperature 102 degree Fahrenheit. Okay, so this ANC will tell how much the client's risk for infection. Understood? That means the neutrophil is the one which determines our, not only neutrophil, WBC also. Okay, WBC and neutrophils both have the indicating factor for infection. Okay, so here the neutrophil count, that means the absolute neutrophil count is 200 only, with along with fever, that indicating client is in a stage of what, neutropenia plus fever. So the leukemia client who is having this and this fever with neutropenia, that means severe neutropenia, that means here there is a risk for developing sepsis. That means temperature always indicating some signs of infection. Okay, here temperature with neutropenia indicating neutropenic sepsis. Okay, if it is not managed, what can happen? Septic shock can happen. Okay, that means
Yeah.
that is a life-threatening complication. So leukemia, already the client is in a stage of cancer, and along with that the client is getting any other infection that will worsen the condition. Okay, so here
Yeah.
option B is the correct answer. Your analysis was correct, Ashwini. Okay.
Yeah.
Yeah, yeah. And have you it's thought about tumor lysis syndrome?
No, not yet, ma'am. But still, I will try. I have studied, but I will try
Yeah,
now.
no, chemotherapy she has taken, no? Chemotherapy.
Tumor lysis. Uh, no, I
Actually,
think today.
chemotherapy side effect only tumor lysis syndrome. I think she has mentioned. No problem.
Mention.
Mention,
Yeah.
yeah. You can see what happened here. You can analyze. You try it. Okay.
Okay.
Yeah.
Yeah. A client with leukemia develops a tumor lysis syndrome. Which finding should the nurse expect? Okay. Hyperkalemia, hyperphosphatemia, hyperuricemia, hypokalemia, cardiac dysarrhythmias. This is select all data play, right?
Mm.
Uh, okay. Uh, Hyperkalemia, hyperphosphatemia, hyperuremia, dysarrhythmias.
You can tell me what are the you are
Tumor,
choosing?
tumor lysis syndrome is hyperkalemia,
Uh,
hyperphosphatemia,
mm.
hyperuremia,
Uricemia, not uremia.
sorry, uricemia, and then cardiac dysarrhythmias
Okay.
because of
Then,
hyperkalemia. Yeah.
then what is happening here in tumor lysis?
The tumor lysis, there will be a uh, accumulation of this one calcium
Actually, in tumor lysis means when we are administering chemotherapeutic drug, no?
therapy.
So this drug will act on the tumor. Okay. That means it will destroy the abnormal. Either it will, that means the tumor means overgrowth, abnormal growth. So the abnormal growth is prevented, and also the abnormal cells can be destructed by the chemotherapeutic drugs. Okay, so what happened? This cells, that means the abnormal cells will what rapidly lyse means it will break down. Okay, breakdown as the effect
Breakdown.
of the breakdown with the effect of the chemotherapeutic drug, and this breakdown uh, products will present in the bloodstream. Okay, understood? That means in a tumor there
Yeah.
may be many content, and this content will when the tumor is break down, this content will what transported into the blood. So this end product will elevated in the blood. Okay, mostly there may be hyperkalemia. Why? Because there is the potassium level will get in the blood will get elevated, and also phosphate level also will get elevated, and uric acid also. These are the end products. Okay, mostly this potassium, phosphate, uric acid, everything is end products only. This will elevated in the blood because of the lysis of the tumor. Okay, But here what happened? The calcium is getting what?
Hypo. Hypo means it will be low
Yeah, it
calcium.
will be low. Oh, yeah, that means hypocalcemia. We know when the cells are destructing, what happened from the in the blood there is low calcium level. Okay, but here it is mentioned hypokalemia. So when there is a hyperkalemia, of course there is a risk for cardiac dysrhythmia can also noted. Okay, and yeah, we can go. Your answers are what are the hyperkalemia,
A,
hyperphosphatemia, hyperuricemia, and cardiac dysrhythmia.
yeah.
Yes, that are the correct answers. Why? Because when the tumor cells are rapidly break down, this cellular content will what this what that means here the abnormal cells are getting breaking down. So this end product or the cellular content will transport it into the bloodstream, and it can leads to hyperkalemia, hyperphosphatemia, hyperuricemia. Uricemia, that means uric acid level is getting increasing, which can lead to gout. Okay,
Yeah.
gout. Yeah, and cardiac arrhythmia. Okay, so hope you got a understood about this, and I will give you with the one more question. You can try it. So there is no option. This topic is question asking area, tumor lysis syndrome. Okay. Are you able to see see this question? Okay.
Yes, ma'am.
Yeah, you can read it and find out one answer.
A client with non-Hodgkin lymphoma, okay, received the first dose of chemotherapy 24 hours ago. The nurse reviewed the following assessment finding. Potassium is 0.5 high. Phosphate is 5.8. Calcium is 7.2. Uric acid elevated. ECG peak T wave. Okay. Urine output is 20 ml. Question: which findings support the diagnosis of tumor lysis syndrome? Select all that apply. Okay. Elevated potassium, elevated phosphate, elevated uric acid, elevated calcium, decrease urine output. So, uh, uh, it's tumor lysis. Okay, which diagnosis will support the tumor lysis syndrome? Okay.
Okay. See,
Uh,
same
yeah,
topic, different type of
same.
question. Understood? Oh, yeah.
Yes, ma'am. Elevated potassium, elevated phosphate, elevated uric acid, and decrease urine output.
And what about calcium? Elevated calcium?
No, no. Hypocalcemia will be there, not elevated.
Hypocalcemia is there, so you are eliminating because and
Yeah.
why you have chosen elevated potassium? phosphorus, as we said, because these are the
Yes.
cellular content. When the chemotherapy drug act on the tumor, the cells will fragmented, or it will break down, and the cellular content will transported into the blood. And why you have selected urine output?
Uh, uh, all this cause acute renal failure, ma'am.
Because there may be, because these products are mostly eliminating through the urine. Okay, this end product will, yeah. So it can lead to what? Acute kidney injury. Okay, so there may be decreased the concentrated urine only. All these components are, this end products are eliminating through the urine. So the urine will become concentrated. It can lead to what? Decrease the urine output. Okay, and not hypercalcemia. Hypocalcemia can be expected. Okay, so hope you got understand on this. One more question I can give.
Yeah,
How you feel the question analysis? Is it good?
yeah, yeah.
Because along with the theory we need to do questions also using right strategy. Not, I'm also recommending you that don't do thousand question. Whatever the questions I are doing, no, do it in a qualitative way, not quantity
Yeah.
we need. Okay, madam, you just do it, analyze
One.
properly, use the strategy, apply the strategy, try to understand your mistakes, and what you have to read the rationale. Always you should have a why question in your mind. Why this option became wrong, why this option become right, and what is the strategy behind that, what is the criteria behind each question, like that. Okay, so you can do this question also. Which assessment finding requires immediate intervention?
Immediate interventions. Uric acid elevated, urine output 20 ml, potassium 6.5 MEq with peak T wave, phosphate 5.8. Uh, uh, I think I will select C, ma'am, because potassium will be high, means dysarrhythmias, maybe cardiac dysarrhythmias. T wave also, it's um, this one.
Here, the topic is which assessment finding requires in what
Immediate
immediate
intervention,
intervention. That means here the
priority.
priority intervention we need to select it.
Yeah.
Okay, priority interventions means which is the most concerning problem. That means the which what in the which finding indicating the worsening of the patient condition, that you need to choose it. Okay, that means we know that for the NCLEX RN question analysis, we know mainly we have to promote the safety of the client. Okay, whatever the options are harming the safety, we can choose. Before that we have to understand the question. Sometimes the question, negative question can be asked. Okay, that means the negative,
Uh,
in such cases negative option is the correct answer. So always what we can read the scenario and understand the question correctly. How? Because by understanding the keyword. What are the keywords here? Which
After
assessment
the
findings
fa-
requires
require
immediate
immediate
intervention. That means the priority management is the word. We need to choose it as the correct answer. For what? Because for the assessment finding, because here they have given some assessment findings, and we have to choose the unstable condition. That unstable, that means the strategy. What are the strategies? Stable versus unstable.
unstable.
Yeah. If in case of stable, what is, which one we can choose it? That means for the
Unstable.
NCLEX priority, unstable patient we need to meet first, then stable patient. Okay. And if it is a situation unexpected versus expected. Okay. That means unexpected situation. For example, if the client has developed a sudden problem. Okay, so in same like here they have given four option. In this four option, three options are expected. Okay, but one finding is unexpected. Okay, so we have to choose which one we we need to choose, unexpected one we need to choose. Okay, and in case of acute condition, or if it is a chronic condition, which one we need to choose it? This acute condition we need to choose first as comparing with the chronic condition. This also we need to see the, so for example, if the client has developed oxygen saturation, the client has developed the dyspnea with the oxygen saturation 94 percentage. Okay, and one patient is a COPD patient. Okay, COPD patient has the oxygen saturation of 85 percentage only. Which one you choose? I will tell you. Actually, Janita also has joined. Janita, don't worry. It is a first class, so you may not get much idea, but you don't worry. Okay, I will. This is the question analysis. So you need to. We need to know what are the strategies behind each question analysis. Okay. So I am giving you two options. Don't think too much. Two scenario. One, COPD patient with the oxygen saturation 84 percentage. Okay.
Okay.
And second option, asthma, acute asthma patient, okay, with oxygen saturation 95 percentage, which is because here this is acute, there it is chronic, okay. But in rare cases, we need to choose with chronic condition with the unstable vital signs. Understood? Otherwise, acute problem is the highest priority, chronic problem has the later priority only. Okay, but in some cases, if the chronic condition has in a stage of worsening condition, that patient will choose first. That means here the COPD patient with the 84 percentage oxygen saturation indicating that is the condition is getting worsening. Understood? Okay.
Yeah.
Mostly in COPD patient, how much is the oxygen saturation? No expected.
88,
Yeah,
88%.
88 to 92 percentage is the expected saturation. Okay, but here the client has how much? Only 84 patient. That means it indicating worsening condition. And also other respiratory condition. Okay, how much is the normal oxygen saturation? 95
95 to
to
100.
100 percentage is the normal saturation. And but here it indicating what? Here the asthmatic patient has asthma, but the oxygen saturation is 95 percentage only. That indicating the client is in a stable condition. That means here there is no hypoxia, but the COPD patient has going in the stage of worsening. That means I am saying that whenever we are getting options, okay, we have to think which patient is going in the stage of worsening condition or which patient is maintaining the stable condition. So we can choose the stable patient as the what, as the wrong answer, and the unstable patient as the correct answer. Okay, so in this scenario is same only. What is the scenario? The client with non-Hodgkin's lymphoma receiving first dose of chemotherapy 24 hours ago. The nurse reviews the following assessment. Okay, so here they are asking about which assessment finding requires immediate intervention. Here we are focusing the criteria what risk reduction. That means reducing the complication. Okay, risk reduction potential. This is NCLEX RN criteria. Okay, so that means here we have to focus on the word complication prevention. Okay, so option A, uric acid level is how much? Uric acid level elevation. Option B, urine output 20 ml per hour. Option C, potassium 6.5 MEq per liter with peaked T wave. Last one, phosphorus 5.8. Okay, that means we know in case of tumor lysis syndrome what are the hyperkalemia, hyperphosphatemia, hyperuricemia, hypo
Okay.
this calcemia can be the expected symptoms in the tumor lysis syndrome. Why? Because the chemotherapeutic drug will act on the tumor. So what happen? It will destruct the tumor. So this when there is a breaking down of the tumor, the cellular components. Okay, we know the tumor is abnormal growth of the cells. So when the chemotherapeutic drug act on the tumor, this tumor will get breakdown, and this cellular component will transmitted into the bloodstream. So which can lead to, what are the two cellular components like potassium, phosphorus, uric acid. Okay, so
Sodium.
yeah. Here what happened, here the phosphate level is increasing, and here uric acid level is getting increasing. So the first option is uric acid elevation. Is it the here nothing has mentioned about the value. Here just mentioned that uric acid elevation. Is the client need immediate intervention here as compared? This question is immediate intervention. Okay, which client need the immediate intervention? That is the question here. Here this value has nothing mentioned. Okay, so we can, of course we need to focus on the uric acid elevation, but here the value has not given, so we can choose it answer as a wrong answer. Okay, understood. Second one,
Yes.
urine output 20 ml per hour. We know that 20 ml per hour is a less urine output in a client with the adult patient. Okay, that means mostly how much urine can be expected in a client?
30, 30 ml
30
per
means
hour.
average. Mostly we are calculating with the weight of the client. 1 ml per kg per hour
kg.
in an adult is the expected urine output. Okay, but in some rare cases, point if the patient has any renal diseases, 0.5 ml per kg per hour can be also expected. Was in some if in a post-operative, okay, in post-operative also in rare conditions 0.5 ml per kg per hour is, and mostly 30 ml we are saying that we are counting as an average 60 kg adult. Okay, in a 60 kg adult 30 ml can be the expected urine output, either 1 ml per kg, minimum 0.5 ml per kg per urine is needed for an adult. Here the urine output is 20 ml only, that means it is less than the minimum. Okay, that means 30 is the minimum adult urine output. So here urine output 20 ml per hour is also need attention, but we need to we can choose this also, but comparing with the uric acid elevation and the option B urine output, urine B is the what mostly the correct answer. That means already we have eliminated option A. Okay, option A we have eliminated. We have confusion with the option B, but we can check with the other option. Potassium 6.5 MEq per liter with peaked T wave. We know that normal, how much is the normal potassium level? Anyone? Normal potassium level? The normal potassium level is 3.5 to, yes, 3.5 to,
5,
yeah,
5.0.
yeah. Mostly for the NCLEX we are expecting 5 as the correct number. In our country 3.5 to 4.5 as the normal value of the potassium, but in European countries and in the NCLEX itself 5 point, not 5.5 can be what manageable. Manageable means that is not in a worsening stage, but if it is greater than 5.5 or if it is a 6, greater than 6, the client need attention. Okay, and also if the client is having greater than 6 with the ECG changes, we know in hyperkalemia tall T wave is can be what seen in a hyperkalemia. That means hyperkalemia leads to arrhythmia. Main ECG changes which occurring in hyperkalemia what stall T wave or peaked T wave. Okay, so here it is mentioned that potassium 6.5, that is which indicating the worsening level of the potassium. That means it is too high. Okay, potassium is 6.5 with the peaked T wave. T wave is peaked means ECG rhythm is getting changed. So this client, if it is we are not managing, what can happen? This client can go into what arrhythmia can happen. Okay, which indicating the arrhythmia. That means both the hypokalemia and hyperkalemia can be a risk for arrhythmia. So if there is a suspected arrhythmia, that is a life-threatening condition. So if the client in the given option, we have analyzed option A, we have analyzed option B, we have analyzed option C. So while analyzing all three options, which is the correct answer? Which option is the finding which need immediate intervention? You just think. Is it the urine output? Oh, option A we have eliminated. Urine output and potassium. While comparing with option B and C, which is the correct answer?
C.
C. Why? Because yeah, at least 20 ml is there, but which indicating kidney injury. Okay, but while comparing with the potassium level, because here there is a risk for what? Arrhythmia risk. So while comparing with this 20 ml per hour urine output and this potassium 6.5 MEQ with the peaked T wave. That means you have to keep in your mind whenever we are managing for the management for the hyperkalemia, first we need to know the normal value of the potassium. Okay, in the NCLEX case study mostly they will give the normal values, but potassium we need to, that is the rare condition, we can memorize it. Potassium, sodium 135 to 145, potassium 3.5 to 5, like that. These are the simple one, we can memorize it. Okay, so we up to 5.5 there is no problem, but if it is greater than 5.5 the client need attention. And if the client need with the elevated potassium, that means it is greater than 6 and with the ECG changes, that is a life-threatening complication. That is my point. Okay, that means hyperkalemia with the ECG changes is a life-threatening complication. So here the comparison with option B and C, option C we can consider as the correct answer. But we have one more option. Okay, we can go with option D, phosphorus 5.8. Yes, of course, hyperphosphatemia is there, and hyperphosphatemia can be a expected symptom of the tumor lysis syndrome. So we can eliminate it. So here we have to choose the unexpected one. Okay, hyperkalemia can be expected, but hyperkalemia with the ECG changes is an unexpected symptom. Okay, so we have eliminated option B. Okay, urine output can be decreased, that be an expected symptom. Phosphorus, hyperphosphatemia can be occurred, that is so an expected symptom. But hyperkalemia is expected, but 6.5 is a too high potassium. Okay, 6.5 with the ECG changes is a abnormal situation or complication or life-threatening situation. So the correct answer is the option C. Understood how we have? It is a simple question, but we should know about what are the hidden strategies or what are the hidden reason or rationale behind each option. If we know it, it would be easy for the question analysis. Okay. So the correct answer is option C, potassium 6.5 with the peaked T wave, because there is a risk for dysrhythmia. Dysrhythmia or arrhythmia is a life-threatening complication. So that option need highest priority while comparing with the other options. Okay. Any doubt on this question analysis?
No, ma'am.
No.
No.
Okay. So I can ask with Janet. Are you following? Janet, is it okay? It's your first class, so you may find some difficulty, but don't worry about that. Okay. Well, on the coming
Okay.
class, yeah, coming classes we will get more clarity on the question analysis. Here we need NCLEX focus theory plus Nugent question analysis using the right strategy. Here we no need to memorize any theory. You just attend the class, okay, attend the class and just clearly understand the theory, okay, and that theory you can
Okay,
apply it,
ma'am.
yeah, apply it in the question analysis, and that will you will get a clarity. Actually, for NCLEX RN we need the clarity, not confusion, okay. Learning a lot of theory, reading centers, and we are doing thousands of questions without any clarity, that won't work in NCLEX. Here we need clear understanding of the theory and the right question analysis using the strategy. Is it, Ashwini? So
Yes, ma'am.
yeah, can you give any, as a beginner, can you give any advice to Janet, that so that it will be helpful for her?
I think we need to focus on theory, whatever they are telling. After that, you need to do the question analysis.
Yeah,
So you will get easy understanding of crack the question the correct way.
correct way. That means that only we are need.
Okay.
Yes.
Yes, yes, ma'am.
Okay, dear. Thank you. So actually today I'm not taking the theory because I had just done the question analysis, so that uh, Janet, please watch the recorded of the beginning session, so you will get an idea about the question analysis. Okay, so
Okay, ma'am.
because already one ma'am has started the theory, so along with the theory we need to do the question analysis also, okay. So I am planning the same, okay. The Rosalind ma'am will take the theory and I will come with the question analysis. So we need to focus on the question analysis thoroughly with the theory. Without theory we can't do the question analysis. We need both theory and question analysis using the strategies, okay. So we can do one more question, and so that you can. Okay, this question is uh, okay. We need the correct order. Okay, we know in NCLEX RN there are many Nugent type question. In one model is drag and drop question. Drag and drop means we need to drag the answer. That means answers may be in a irregular order. So we need to drag the options and we need to make it as a order. Okay. So in this question, place the nursing actions in order. Okay, nursing actions they put in a wrong order. We need to make it in as a correct order. Okay, managing a client experiencing chemotherapy induced neutropenic fever. So here the client has the neutropenia and also the client have the fever. Okay, so obtain cultures, assess vital signs, administer antibiotics, monitor response. In such cases, for a care plan based question, we can use the method ADPIE. Okay, ADPIE means what? A means,
Yes, ma'am.
yeah, A means assessment. Assessment, we need to get a data. Data means subjective data and objective data. Yeah, subjective data means whatever the complaints which are
Okay.
set by the client. Objective data means what are the findings we are getting after assessment. Okay, for example, if we a dyspnea patient on auscultation, we got that diminished breath sounds. That is an objective data. Okay, and the client is saying that I have I have difficulty to breathe. That is subjective data. That means whatever complaints are said by the client, that is subjective data. What are the complaints which assessed in the client by the healthcare? Okay, that is the objective data. Okay, and D D means diagnosis. Okay, yeah, diagnosis means according to the assessment findings, we can make a what nursing diagnosis. Okay, diagnosis, and P means planning. Okay, P means planning. That means
Calculation.
according to the priority of the problem, we need to plan the care. Okay, we know the nursing care plan. That means What are the in the nursing care plan? What are the steps of nursing process? Anyone
Yes.
remember? Yeah.
Assessment, diagnosis, planning, implementation, evaluation.
But in a nursing care plan, one more option, one more column is there. That is rationale. That means,
Rational.
yeah, that means assessment, diagnosis, planning. Okay, whatever the actions we are planning, that should have a rationale. Okay, and whatever the actions plan we can implement in the client, that is the implementation. Plan of action is intervention, next is rationale, next is implementation, last is the evaluation. Okay, evaluation and documentation. And here we need to focus on whatever the care we are planning for the client, that should have a scientific rationale in that. Okay, so at P assessment, by checking the assessment we will get the subjective and objective data, and we can make the nursing diagnosis, and according to the priority of the problem, okay, we can plan the care priority of the problem. And next is I means implementation. Implementation means action. Okay, implementation or action, that means we can do the planned care. And E means last one, E means
Evaluation.
evaluation, that means we need to evaluate the care. That means the whether the client got any progress in the condition. Okay, progress or unchanged, or the client is maintaining the same situation. Okay, or the client has condition has worsened. That is the evaluation. Okay, so that this tool, this ADPIE tool, this is it's a main important tool which are coming in the Nugent question analysis. So it's very important one, so you should thorough about it. Assessment, diagnosis, planning, implementation, and evaluation. Okay, so this order you can apply it in this question. Okay, because it's a nursing action related question. So using the strategy, both of you can just try, and you can put your answers in the chat, we can check it. Okay, assessment, diagnosis, planning, implementation, evaluation, these tool you can apply it in the given four option, and give me the order. You can put the chat, your answers in the chat. You just try it.
Monitor response. Monitor response means client ma.
Yeah,
Client
that's the evaluation. Response, client's response. Ashwini's answer is 4213. 4213. And Janet, your answer? You just try it, no problem. Okay, if it is wrong also, no problem. Just we are making understand whether.
Okay.
Yeah. Yes.
1 minute, ma'am.
Okay. So no problem. You can send me later. You just listen the this one. So I am going with Ashini's answer 4213. For monitor response, then 2 assess vital signs, 1 obtain culture, 3 administer
ten.
IV antibiotics. How the 4132. Okay. Janet 4132. Is it?
Yes, ma'am.
Yeah. 4132 is 4132. Okay. See, obtain culture. Is it a assessment, diagnosis, planning, implement? What is? It is a
Planning.
planning. Obtain culture, planning. So you are saying I am going with you. Okay, you are saying it is a planning. And assess vital signs.
Assessment.
Assessment. And administer antibiotics.
That is action. Implementation.
Yeah, implementation.
Monitor, response,
Yeah, monitor response.
evaluation.
So check your own answer, which is correct order. What is the
No.
question here? Question:
Place the
place the
correct
nursing actions in order for
managing
managing a client experiencing chemotherapy induced neutropenic fever. That means we need to give the what the client is receiving the chemotherapy. Okay, and here we need to uh, plan the what nursing actions in the priority order. So you have chosen evaluation as the first one. Is it evaluation first one?
the.
Hmm?
Yes.
No, ma'am.
No. Second, I am assessing with the Ashwini to assess vital signs. Is the assessment second one?
No, actually, first one will be the assessment.
Okay, so you just try the answer.
Because because I asked, monitor response will be the
So
client's this one.
I told you yes. Patient's response means what? Valuation. Response means what? Valuation.
Evaluation.
Yeah. Okay. So
No, two,
then
one,
this.
three, four.
No problem, dear. Second one is obtain culture. So that means
Yeah,
one. Then intervention or implementation, which is the one? Administer.
three. Administer IV antibiotic.
Yeah. Last one. After the IV antibiotic, last
Four.
one,
Monitor.
evaluate the
Evaluate.
response. See, we can check it. Yes. See, assess vital signs, obtain culture, administer IV antibiotic, and monitor response. Okay, understood your mistakes and which strategy and how the strategy applied in the question analysis. Is it easy or is it tough?
Yes, ma'am.
Actually, it is easy only, but the thing is that
Yes,
through constant practice only we will see. Even you know what is ADPIE, but you know everything, but you made the mistake. That is going to happen in your what final exam. Sometimes the options are easy, but we might some difficulty in what analyzing the question, so we will get the wrong answer. So see, that means in drag and drop type question, yeah, first one you made the answer what wrong answer. So all the options will get what. See,
Wrong.
second, yeah, wrong only. See, here Janet second answer was correct. Okay, and third answer was also correct. But she has exchanged with the first option and the last option. But Ashwini, see, all the options went wrong. Okay, this is the thing which is going to happen in our final exam also. It is a easy question, but it little bit confusing words will be there. So you should what efficient enough to identify what is the stage is coming under assessment, what is the thing in coming under planning, okay, what is coming under evaluation. So it would be easy for you. Okay, don't no need to worry about, but we should apply the strategy in the question analysis. That is the correct method, so that you can make the question analysis so easily. Okay. And one more thing, if you are getting, if it is not a priority order, it is not, the question is which is the priority action. Not order. I am asking about the question. I am changing the question into priority action, nursing action, which is the correct answer here.
First priority, yeah, monitor response.
How the see again? Actually, I think Ashwini has some confusion with this. Monitor
Assess vital.
response when we are monitoring the
Vitals,
response.
ma'am.
After
Assess
giving the
vital.
care only we are monitoring the response. We are evaluated. Without care, how
Because
can we evaluate the patient?
of I am getting confusion with the chemotherapy patient, we are always choosing for a response, no? So I am in that
No, no.
sitting in that.
No, no, you don't see. You just understand the question clearly. They have given the scenario only experiencing chemotherapy induced neutropenic fever. That is the condition of the client. So, whatever is the condition, okay, if it is a disease condition, if it is a drug related condition, whatever is the condition, assessment is, if it is a stable situation, assessment is the highest priority. Okay, understood? I have
Yes,
told,
ma'am.
yeah, assessment is the first step in every action. Okay, and see, in case assessment is first in case of stable condition. But if you are getting a condition, unstable condition, in such cases, which one implement? See, sometimes if the client is if you are getting that a client is suddenly developed any complication, okay, in such cases unstable condition, we the first step is implementation. So this is very important one. Implementation will come first in case of unstable. For example, we should know if in a, the client went to unconsciousness, okay, you should not wait to check the what that means if the we have to check the response of the client, and immediately if the client is not responding, we should do the CPR first. In such emergency cases, you should not wait for the crash cart, you should not wait for the vital signs monitoring, you should not wait for the intubation articles, okay. And also when we are getting an options with an unstable condition, intervention or the action implementation will come first. But in a stable scenario, assessment will come first. But here the client plays what is the priority nursing action for a client experiencing chemotherapy induced neutropenic fever. Here, which one? Here the assess vital
And talk.
signs is the priority action, okay. But if they have mentioned about the fever with the what 105 or something temperature, if we have instead of antibiotic, if it is an antipyretic, so which is the priority, already they have given the what temperature. So if it in such situation the client is going into a complication stage, so you have to choose the administer IV antipyretic. That is the emergency correct option, okay. So don't confuse with the ADPIE. ADPIE you should be very thorough. Assessment, diagnosis, planning, implementation and evaluation. If it is in a stable scenario, assessment will come first, but it is in an unstable scenario, implementation will come first, okay. Any doubt?
Um,
No, ma'am.
Okay, so you can watch Janet can watch the recording, okay. And you just try to, I will send some questions, you try to do the answers just for assessment test, okay Janet, okay. I will send it. And
Okay, ma'am.